Welcome to this NCFE video focusing on top tips for taking on the role of the standardised patient for the role play task as part of the Health Employer Set project. Firstly, let's look at what a standardised patient is. It is a person who takes on the characteristics of a real patient. The role of a standardised patient is to independently, consistently, and accurately convey details of the patient's life in an appropriate and consistent manner. Tutors or subject matters experts can take on this role. However, they should ensure that they have the appropriate subject knowledge to understand the nature and complexity of the role. If you are taking on the role of the standardised patient within the role play task, here are some top tips. Research the principles of good practice in presenting simulated patients. You should read around the subject prior to taking on the standardised patient role. NCFE recommends the following reading material: the Simulated Patient Handbook, a comprehensive guide for facilitators and simulated patients by Fiona Dudley. This handbook provides guidelines on the essential skills of characterization and supports standardized patients to learn best practice. Have the relevant brief available to refer to during the role play. It is important that you do try to memorize the patient's details from the briefs, but you can also refer to the brief within the role play when required. This is to ensure that when you are answering the questions from the student, you have the correct information. For example, if the brief states that the patient has mobility issues and has fallen at home, then you should refer to this when being asked about support needs. This may prompt a further line of questioning from the student about mobility aids that may be able to support you as the patient. Remain in a specific patient character when responding to questions. Although the student may know you as their tutor, it is important that you act as the patient throughout the role play and do not refer to answering questions as anything other than the patient from the brief. This will support students to also remain as character within their role. It would be recommended to remind students of both of your roles prior to starting the role play assessment. Play the role play in a convincing but not melodramatic manner. It is important that, as previously stated, you remain in the patient character, but if you play the role too over-emotional, this can be off-putting for students and take away from the aim of the task, which is to gain information from you as the patient. You should answer the questions based on the information given from the brief and refrain from communicating in an over-emotional way, for example, pretending to cry. Furthermore, you should be mindful of your body language. Body language is a very important part of communication, so it's important that your body language remains open to put the students at ease when they are asking you questions. You should have an open posture and not cross your arms. You should also maintain good eye contact and include gestures such as nodding when being asked questions to show that you are listening to the question. It is also important to be aware of your facial expressions, as these can convey emotion. So if you look very stern, the student may feel that you are unhappy with their line of questioning. Use language that is appropriate to a typical patient. Patients will generally not use medical technical terms, so refrain from using these overly medicalized terms when answering questions, as this may confuse students. Avoid embellishing the condition in a misleading way. Although it is important that you appear authentic as the patient, you need to ensure that you do not over-exaggerate the condition, but just use the facts from the brief and what is appropriate to the task when answering questions. For example, if the brief states that the patient has memory issues, you should not state that you can't remember the answers to some of the questions being asked, as this would be detrimental to the student. Play the role play consistently so that every student has the same experience. For each brief, you should ensure that students are not provided with different answers to the same types of questions. It may be useful for you to make notes about each of the briefs based on the questions the students may ask to refer to within the role play. If more than one tutor is playing the same patient from a brief, you should set up a standardization session prior to the role play to ensure that you are all consistently playing the role from each brief in the same way. From the standardization, you may also develop standardized notes to use within the role play. Repeat information that a student has not understood. If a student has not understood an answer that you have given, you are allowed to alter the wording you use so that they understand. You are permitted to rephrase your answers. However, just be careful not to change your answer too much to give the student an unfair advantage in comparison to other students. You should always ensure that your approach to answering the questions is consistent across students. Avoid tips or prompts. Be careful not to provide tips or prompts to the student about what they should be asking, as this can make the assessment less challenging and provide them with an unfair advantage. Avoid leading answers and only base your answers using the information from the brief and what is relevant to the task. Practice being a standardised patient. To support you with the standardised patient role within the assessment, plan some time to practice being a standardised patient with students prior to the employer set project so that you become more confident and familiar with the role and how to answer questions appropriately. This also gives students the opportunity to practice asking questions as a health professional. Position yourself appropriately to aid communication. It's important that you face the student when answering questions so that they can not only hear your verbal response to the question, but also see your body language. Sitting facing the student supports them engaging them in conversation and avoids them missing any non-verbal communication you provide with your verbal answers to the question. Thank you for watching this video, and I hope you have found this useful in preparing to be a standardised patient. If you have any further questions about the Employer Set project or specifically the standardised patient, please attend one of our Employer Set project drop-in clinics. We are also hosting a live webinar on the standardised patient on the 19th of October 2022. All professional webinars you can sign up for via the events and webinar section of the provider support page on QualHub.